New videos every day.
Hi everybody, this is Dr. Echols, and today I've got Karina here again with me, and I'm going to actually go through a little bit of an education process with her, and let her know a little bit about some background on chiropractic, how to look at symptoms, how to regard those, find out what a subluxation is and what are the different components of it. So these are some of the educational processes that I would actually go through with a regular patient, and I wanted to share those with you today. So Karina, in my office, you would have actually got a chance to look this poster over, this little pamphlet, and this one is on symptoms. Okay, and one of the things that I really want you to know about what a symptom is, what is the definition of a symptom?
Symptoms are a warning sign.
Yeah, exactly. So a lot of people mistake the symptom for the actual problem itself. Let me give you an example. Let's say that a fire alarm goes off here in the room. Okay, the fire alarm is not the fire, is it?
Right.
It's just an indication that there is a problem. Right? So it's the same thing with the pain in your head or your sinus problems or your pain in your neck or in your back. Those aren't actually the problem itself. It's just a signal that there is a problem. Okay. Does that make sense? Mm-hmm. And if you wouldn't mind, just read this paragraph right here for me.
Chiropractic doctors find the underlying causes of your ache or pain and help to correct it.
Yeah, so we're not going to be trying to treat your fire alarm. You know, it wouldn't make much sense if I just went and cut the wires to the fire alarm and go, hey, now we're okay, right? I fixed it, right? We're not going to do that. So, but a lot of people do that, don't they? Mm-hmm. Let's take a look at this. If you wouldn't mind reading that for me.
Covering up the symptoms with medication can ignore the underlying cause and delay the healing process.
Yeah, and have you ever known anybody that did that?
Yeah, well, even just like taking antihistamines to stop your stuffy nose or whatever, rather than addressing what's actually causing your stuffy nose.
Yeah,
right?
Exactly. And have you ever known anybody who just kept taking medication for whatever symptom it was, and they just kept taking it over and over and over and over again?
And then you need more and more and more of the painkiller to get rid of the headache.
Yeah, and then what is sometimes the end result of taking all that medication?
The underlying problem gets way worse and ends up, with a more significant health issue than just the headache or just the back pain.
That's right. And is it possible that the medications themselves could cause some issues?
Of course.
Yeah. So then they have to take another medication to counteract that one. Mm-hmm. And then eventually that causes a problem. And before we know it, the person's on 15 different medications.
I've definitely known some people like that.
Yeah. And what's the very end result of all that?
You end up with worse health issues than you had before.
Yeah, and those keep getting worse, and then eventually what happens?
You die.
Exactly. So what we want to do is we want to find out what the underlying cause is and get it corrected, rather than just pouring a bunch of medications on it and that kind of thing. So do me a favor and just read this paragraph right here.
Judging your health by how you feel can be dangerous. The first symptom of high blood pressure is often a deadly stroke. The first symptom of heart disease could be a fatal heart attack. Because your body is so adaptive, by the time many symptoms warn you of a problem, it can be well advanced.
Yeah, exactly. What does that mean to you?
So that waiting for the sign that you have a problem or the sign that you have an illness, sometimes it could be too late, because by the time you're actually getting a signal, like a heart attack or a stroke, the problem is so far along that it can't be fixed as well as it could have if you had addressed it earlier on.
Oh, that's beautiful. Exactly. Have you ever heard of anybody that this has actually happened to?
I definitely have known a lot of people that, it's not until after they have a heart attack or after they have a stroke that then they start addressing whatever lifestyle issues or whatever other health issues it may be. And then by that time they're dealing with all of the effects of the stroke as well, in addition to what was causing that in the first place.
Yeah, exactly, because these people don't really have a symptom to tell them that there's anything wrong. So the bottom line is it's very difficult to gauge how healthy you are by just how you feel. We've all at least heard of somebody who felt fine and they went to the doctor to have a checkup and found out that they had cancer. And they also found out that cancer had probably been in their body for over 10 years, with no kind of warning sign that had been happening there. So it's very difficult to gauge your health by just how healthy you are. The same is true when we're talking about your spine and spinal problems. Sometimes I'll have a patient say, no, I don't really have any problems in my neck, for instance. When we take a picture and we look at their neck, they actually have significant problems in their neck, a lot of degeneration, which we may talk about earlier, but they don't yet have the warning signs or the symptoms to tell them that they should be doing something about it. So we want you to have as much awareness about your body as you possibly can, because that way you can be much more proactive about your health. And when that happens, you're able to get a lot better results. Very good. Now let's talk a little bit about what I would treat, which is what we call a subluxation. Now, if you'll go ahead and read this is the vertebral subluxation complex is the underlying cause of many health problems. So read the definition of vertebral for us.
Vertebral, concerning the vertebral bones of the spine.
So good. Vertebral is the vertebral bones of the spine, which are these here. Okay? Now go ahead and read the next, the definition of subluxation.
Subluxation, less than a complete dislocation of a joint with nervous system interference.
Okay, very good. So have you ever known anybody who's maybe dislocated a shoulder or a knee, or have you ever heard of that happening? What happened to them when that happened?
It hurt?
Really bad, right? Yeah, you can just imagine that if I took your shoulder here, and I promise I won't, but let's just say I completely pulled it out of socket, that's going to be pretty serious,
yes.
Really painful. Well, a subluxation is something a little bit less than that. It's not a complete dislocation, but it is a subluxation. It's moved out of its normal place, and very importantly, it's it's causing nervous system interference. Okay, so it's interfering with your nervous system. So let's figure out a little bit about what your nervous system does. If you'll go ahead and read this paragraph right here, nervous system function.
When there is no interference, your nervous system controls the healthy function of virtually every cell, tissue, organ, and system of your body.
Okay, so what does that mean to you?
Your nervous system, when it's working correctly, is responsible for all of your cells and tissues communicating with each other, sending messages to and from your brain and to and from different parts of your body.
Excellent, very good. So if no interference in your nervous system is equal to healthy function, then if you have interference, you're going to have what?
You're going to have not healthy function.
Not healthy function or unhealthy function, exactly. So let's say that you did have some nervous system interference in your nervous system due to a subluxation. What are some of the just possible symptoms that could occur?
Well, back pain, of course, even headaches, or I guess pain really anywhere in your body would probably come from your spine.
Right.
I'm kind of cheating here, but I guess you can see that there are other potential things that can be affected too in all of your different organs. Exactly.
So, there's a lot more that our nervous system does besides just pain. Did you know that? Yeah. It carries all of the different sensations, balance, all kinds of different proprioception. It does a lot of things. So only a small portion of our nervous system actually feels pain. So your nervous system could be being interfered with and you not have any pain to really tell you about it.
Okay.
For instance, what would happen if the nerve that goes to your eye had a subluxation and that nerve that goes to your eye was not getting the proper signals? What would be some of the possible problems that you could develop?
Something like blurred vision,
yes,
or even blindness.
Blindness, absolutely. I actually had a patient who had his eyesight restored with chiropractic care, because if there's a subluxation there, the signal to the eye can't get there. Even though there's nothing wrong with the eye itself, the signal going to it is not going to work right. Just like if the signal going to your monitor and your computer was not getting there, even though there's nothing wrong with the screen, you're not going to get a very good picture, or maybe even no picture. So in his case, he got his eyesight restored. What would happen if you had a subluxation here in the back and this nerve was going to your stomach? What do you think some of the possible symptoms could be?
You'd end up with digestive issues or heartburn or I guess any number of different digestive issues.
Very good. Absolutely, because when the nerve to the stomach isn't working, the stomach isn't going to get the nerve supply it needs to carry out all the functions, and the food may not get digested properly. And we could get those kind of things: heartburn, reflux, a whole host of all kinds of digestive problems. So moving down the spine, let's do one more. What would happen if you had a subluxation in your spine and it was interfering with the nerve that went to your colon?
That would be very unpleasant.
It could be. It could be. What do you think are some of the possible symptoms that you might have?
Yes, constipation or other, talking about digestive issues again.
Exactly. So you could get constipation. What about diarrhea? Absolutely. You get either one of those, or just chronic bowel inflammation or problems can be due to that too. Exactly. So we found out that when you have a subluxation, it can almost cause anything, because a subluxation by definition interferes with your nervous system.
Okay.
So we found out that a subluxation is a little bit less than a complete dislocation, and there's nervous system interference. And we've already discovered that when you have nervous system interference, it can cause almost any kind of symptom that you want to. We talked about the eye and the stomach and the colon, but there's obviously lots of other things in the body that can go awry. So we're going to give you an example of what an adjustment would look like and how we would go about correcting some of the subluxations that are present. On this particular one, we're going to be focusing more on the lower part of the back. So Miss Karina, if you'll roll onto your side for me. Very good. And we just feel these bones here in the lower part of the pelvis and of the back. And her whole pelvis is kind of rocked back this way. So we're just going to put a little light pressure here. Just like that. And that kind of clicked into place very nicely. How did that feel? It felt good. Excellent. So I hope that's been helpful. I hope you've learned a little bit about what a subluxation is and what are some of the probable effects of that and how to take care of it and how to prevent it. Please go to my website, www.jeffechols.com, for further information. So in the next video, we're going to actually discuss some of the other components of a subluxation and find out what those are.